This has been a crisis for half a decade now. Successive governments have put effort into this. We appointed a standalone Minister of Mental Health and Addictions. Minister Darcy will have more to say about the numbers today. I believe she's issued a statement. We're creating more treatment spaces. We have an act before the legislature that will help young people, particularly stay in hospital under medical supervision while they regain their faculties and decision-making processes are clearer for them. That's yet to pass the legislature, but we're doing everything we can to give parents some confidence that the Crown, the state, will do what we can to help their children when they run afoul of illicit drugs, currently illicit drugs. But this is a health issue, abundantly clear to me, and I think to the vast majority of British Columbians, and we need to tackle it as such. And that's going to require, again, national leadership, and I'm confident that the federal government will join with me once we move through this restart period and start to focus on the suggestions that are many throughout the community, not just the national police chiefs, but service providers for many, many months now have been talking about what we need to do to address this issue, and we're committed to doing everything we can. We consulted with the First Nations Health Authority about the legislation that's before the House. We have worked with rural and remote and Indigenous communities to get more dollars into communities through the pandemic. Those can go to providing health care. We want to make sure that we're bringing health into communities. Telehealth and a whole host of other technological innovations are opening up doors for patients and for people struggling with addictions that weren't there before, but we need to make sure the technologies are in place and they're affordable for people and for communities, and we need to connect those communities with broadband internet service. This is an initiative that the government's been working on for a number of years. There's no one quick solution to this problem, but it's all of us working together, and most importantly, all of us recognizing that these people who are addicted to opioids are not criminals. They're patients and they need medical care. As we review the Police Act, which is just underway, we'll be able to look at where we can put resources to health care and the delivery of services for people rather than incarceration, litigation, all of the things that have slowed down success in our province. We want to make sure we're removing those barriers and giving people access to the services and particularly the treatment that they need.